Good morning. It's good to be with you all. I'm Dr. Gary Smith, Medical Director for the City of Mesa Fire and Medical Department, and we're here to talk to you about a new type of device that we're going to be utilizing within the organization that is called the OLAES device. I'm here this morning with
Tommy Sanfilippo, engineer, paramedic with the City of Mesa Fire and Medical Department.
It's great to be with Tommy and great to be with all of you, and we look forward to helping you understand how to deploy such a device. And this is used for those that have significant hemorrhage as a result of some kind of traumatic event that may have occurred. You would begin to deploy this device by taking it and opening it in this fashion. You'll be able to take it out and you'll see that inside there is a piece of paper that surrounds the actual device itself. We would then remove this packaging from the actual device itself, and you would discard of that. And then you'll find that this is completely all rolled together, and as such you would then be able to unroll it just ever so slightly to where it is that you can unpack what is in the interior of this compression bandage. First, you'll notice that there is a piece of plastic that will come out, which is an occlusive dressing. This occlusive dressing is meant to be utilized on the thorax. However, we will not be using this at all, as we have our own deployment device.
The Halo chest seals.
The Halo chest seal, which it is that we will not be explaining today, because it's already been deployed on your fire apparatus and for use with our patients already. So we'll discard of that piece of plastic. On the inside of that, you will then find gauze that is also then present, that's going to be used as we would deploy it into the wound, and this becomes the packing that goes into the wound. Other components that we have of this is of this compression cup that you will find that's here, and as you have an opportunity to take a look at that, with deployment, this cup will go on the proximal end of the wound. In other words, that which is most close to the thorax or the trunk of the body. And then you'll see that this compression bandage, it's stretchable, and so therefore can be utilized to help for increased pressure that will be placed upon the dressing and the pressure cup. There are areas that have also Velcro, where it is that they'll also be able to then be self-sealing once it is that we have completed using this device.
Dr. Smith, can you show us on a patient where wound packing is appropriate?
You know, Tommy, we can actually use it anywhere on any of the extremities, from the ankle coming up to the groin, or from the wrist even up to the axilla. Primarily, this device is being used here in the groin, as well as those areas of the axilla. The reason for that is, these are difficult areas to apply a tourniquet. Now, if I were to have an injury that was down here on the calf region, we could actually deploy a tourniquet that would come down and be able to manage the hemorrhage that would be occurring in those locations. However, here and here, so the groin and the axilla, are two areas where it's far more complicated to deploy an actual tourniquet. Now, some may ask, can I use a tourniquet and the OLAES device? And the answer to that is yes. You can use both.
Can you now describe when it's not appropriate to use wound packing?
Certainly. There are times where it is that a wound may be minimally bleeding. And if that wound is only minimally bleeding, it's because of the fact that the artery that has been cut, lacerated, has retracted back up into the wound itself, and the muscles that are surrounding where that area proximal to the wound will begin to spasm, as will that distal end of the artery. That will stop bleeding from occurring. And when bleeding is no longer occurring, or it's minimal, that is a time when packing would be inappropriate. Another time would be, of course, if it is that I had a wound that was up here in the neck, and we want to make certain that we are able to manage those wounds. Those wounds can be managed with direct pressure, as opposed to using the OLAES device. The OLAES device would cut off a person's ability to breathe, and we don't want to hinder the person's airway. Hence, you can apply direct pressure into the areas of wounds, whether it be posterior or lateral, or even on the anterior aspect of the neck. That would be sufficient.
Thanks, Doc. What about the chest and abdominal cavity?
Very good. Some of the things here, when we start talking about the thorax, of course, internally, inside the thorax, we have the lungs. And if we have a wound that's deep enough that's going to be causing a problem here within the chest cavity, more than likely we're going to need an occlusive dressing. And that bleeding would be coming for something much deeper. And when we consider that of the abdomen, the abdominal cavity, of course, has much larger blood vessels that will go down and supply the lower extremities. And that deeper bleeding is an area where it is we do not want to apply any kind of compressive device, nor do we want to do any packing in those areas. We would want to continue to use large abdominal pads with dressings that could then be applied. If it is that there's an evisceration, we would want to moisten those abdominal pads with saline and then go ahead and apply that onto the abdomen and wrap the abdomen so that we are not causing any additional injury or harm to the intestines or any of the other intra-abdominal organs.
Thank you, Doc. What about scalp wounds?
You know, it's interesting that you ask about that too, Tommy, because here on the scalp wounds, when we start to consider those, it's an area that bleeds quite readily, and it's very vascular. And we know that we have a very fibrous type of tissue that's underneath the skin and the dermis. And so as we go down through the dermis that is heavy vascular, we'll find that a head wound will bleed very easily. And so when we look at these scalp type lacerations, applying some pressure with just a dressing of its own without doing any packing, because we don't know if there's a skull fracture that's underlying that and causing any kind of cerebral trauma, we do not want to exacerbate anything that may be occurring inside of the brain. And so therefore we would only apply a dressing to the outside, and then we can wrap that as we normally would, and as we've been taught ever since EMT school.
Awesome. Thank you, Doc.
You bet. Well, allow us now to demonstrate how this would work. And with that, it really requires two people in order to deploy the device. One to help hold an extremity or to help manage a person's torso so that we may be able to apply the device. So let's take, for example, that we have that left leg, but the injury is up here in the left groin region. If it is in the left groin or inguinal area, we would want to then use this device, because it is a location where it is that we cannot apply a tourniquet very effectively. And so then we would come down and take a look at how that would be used. The first thing that would happen is that Tommy is going to remove a portion of the gauze. You'll take out approximately the size of a ping pong ball. Apply some pressure on the inside of the wound to try to dab and see where it is that that bleeding may be coming from. If it is that we can determine exactly where the bleeding is coming from, that is the location at which it is that we would apply the initial direct pressure of the packing that would go into the wound. Most commonly, that's going to be coming from the proximal or closest to the torso portion of the limb. And so Tommy has located that area. He has now had the packing that has been placed, and he'll continue to pack that. And as he's pushing that in there and he gets as much in as he possibly can, it is not necessary to use all of the gauze. However, if you run out of gauze, you would acquire some additional sterile gauze that you can then apply over the top of that. Once it is you've put as much in as you possibly can, at that point, the second person is going to come to help provide some assistance. And that's going to be to lift the extremities so that the individual that's performing the packing is going to be able to put as much in as they possibly can. That pressure cup is then applied over the top of that. And then we would go ahead and wrap the wound as tightly as we possibly can with that cup that's providing the compression at the proximal end of the wound or directly over that site. And then we have two hook devices that will then secure the bandage into place. And that would then apply for about 3 to 5 minutes additional pressure that would be coming on top of that pressure cup with the heel of the hand, and then transporting the patient to the trauma center where a surgeon would be able to help repair the wound. And as we consider just that golden hour, when it is that a patient may have had an injury, to the time which it is that we can help them get to definitive care, where it is that they may be at a trauma center, where a surgeon may be able to provide them with greater assistance and helping them to get to where it is that their life will be restored again. we at the Mesa Fire and Medical Department will be able to assist these patients in a much better way that are having profuse bleeding where it is tourniquets cannot be applied or may not be applied in an effective manner. We can continue to use the OLAES device with its packing, the compression cup, and then using that compression bandage to tighten it down as best as you can, applying that pressure and getting them to the trauma center. Thank you for taking time with us this morning. We appreciate you sharing this with the Mesa Fire and Medical Department.